Welcome to CMXP2 InterSect Asia, the podcast where bold ideas meet insightful conversations. This series is designed for business leaders and board members, tackling some of the most pressing issues in high-regulated sectors across Asia, from agriculture and agri-food to food and nutrition, life sciences, and global banking and markets. I'm Yashna Harjani, Senior Partner and Co-Head at CMXP2, a strategy advisory firm specializing in marketing, compliance, advocacy, and sustainability branding across these industries. Today, we are diving into a critical yet often misunderstood topic, malnutrition. It's a paradox that includes both undernutrition and overnutrition, driven by everything from poor diets and economic disparities to lack of access to quality food. Addressing this challenge isn't simple. It requires innovative, multi-sectoral solutions tailored to different populations and contexts. And to help us break it all down, I'm thrilled to welcome Dr. Regina Moench-Pfanner. A global expert in public health and nutrition, Dr. Moench-Pfanner brings over 35 years of experience advising governments, the private sector, research institutions, and international organizations like WHO, WFP, UNHCR, the Red Cross, and Swiss Development Cooperation. She's also a member of CMXP2's The Big Hats Expert Panel. Dr. Moench-Pfanner, welcome to the podcast.
Thanks for having me, Yashna.
Let's start with the big picture. How would you describe the nutrition landscape in Southeast Asia today?
Well, I would say the nutrition landscape in Southeast Asia is rather complex because we have different forms of malnutrition coexisting. And we have undernutrition, we have overweight, obesity, and micronutrient deficiencies. We refer to this as the triple burden of malnutrition. Currently, what we see is a rise in overweight and obesity, specifically among adolescents. This is very concerning because if you are obese during your adolescency, you actually contribute to being, as an adult, much more obese. And obesity leads to much more incidences in terms of non-communicable diseases, such as diabetes type 2 and cardiovascular diseases like hypertension and strokes. We also see at the same time still millions of people in Southeast Asia affected by undernutrition and micronutrient deficiencies.
It's fascinating, and a little alarming that undernourishment and obesity are both major concerns in Southeast Asia. So what's really driving these trends?
Well, I would say we have poor dietary habits and we also have lifestyle changes. So if you look at Southeast Asia, we see rapid urbanization. So we see many people leaving the remote areas, going into towns and changing their work for more sedentary work. So we have less physical activity. Mm-hmm. On the other hand, if you recall, the diet in Southeast Asia is still based mainly on rice. And for low-income consumers, there is few pieces of meat, vegetables or fresh fruit. And that brings you also to consuming a rather monotonous diet, which doesn't bring you all the essential micronutrients that you need. On the other hand, we also see an increased consumption of highly processed foods. That's mainly for convenience and also because they are more affordable than the more expensive nutritious foods such as fresh products. And we also see, particularly among adolescents, school kids, so 12, 13, 14, 15 years old, a big consumption of sweetened beverages. So if you take all this together, that really leads to a situation where we actually have quite a problem with overweight, obesity, but we also have micronutrient deficiencies, and we still have amongst the very, very poor a high rate of undernutrition.
So do you think that's one of the reasons why we're actually seeing the triple burden of malnutrition in the same individual and in the same household?
Yeah, that's actually quite interesting because the triple burden of malnutrition can exist in one individual. So let's take a child as an example. So you have one child that is too short for its age, which is a long-term chronic undernutrition problem. Same time, this child is micronutrient deficient because it didn't get enough food and it didn't get enough essential vitamins and minerals, therefore micronutrient deficient. But it can be also obese and overweight because if you got food, it might have been the wrong food. And we call this also empty foods, empty
That's
calories.
Yes.
So that means that you can have this in one child. And if you apply this to a household, we see now, and we have statistics for this, that a majority of women in reproductive age or even pregnant women are overweight. Some of them are really already obese.
Mm-hmm.
Then in the same household, you still have a child that is undernourished or stunted. Stunting rates in Indonesia are still unacceptably high. And we can have a grandfather, who is not eating properly. And we know that, the elderly, they are lacking very often of good protein and calcium. So you can have this phenomenon in a household. And of course, you have this in a nation. That means that it's very difficult and challenging to come forward with appropriate strategies because you have to address each type of malnutrition with specific strategies.
Wow, this really shows how malnutrition is more than just a lack of food. It's about quality, affordability, and habits. So how does it affect the different life stages?
Well, I would always like to refer to it as like a vicious circle. It's a vicious circle in the sense that if you as a child have been malnourished, severely lacking micronutrients that are so essential for your growth, your cognitive development is impaired, your physical development is impaired, and it leads you into being a toddler, being a young child, being an adolescent, and you carry this impairment from being malnourished into later adulthood. And that means that if you're an adolescent and you have been malnourished and you happen to be a girl, you might start your pregnancy already malnourished. And then as a mother, you are not giving the best diet and you don't lay a good foundation for then having a child that is really healthy. We always say mothers are healthy, children are healthy. So when I say a vicious circle is that we have to actually prevent that we are giving this malnutrition problem to next generations. And that's why I would always say that we have to try to prevent and go in and give good foundations for diet before pregnancy, during pregnancy, adolescence, and so on, in the different life stages.
So basically what you are saying is that women and girls are more vulnerable and they should be targeted first in terms of malnutrition?
I would argue that women and young girls are more vulnerable because they give birth. So they actually set the stone for the next generation. And if you want to tackle this, you really have to go and make sure that you can go and give them a good start. So I would say if you want to tackle the triple burden of malnutrition, particularly for low-income consumers, where we also see a lot of malnutrition problems, we normally talk about the first 1,000 days. And we call this the window of opportunity because it's from pregnancy through the second birthday of a child. And if we can manage to make sure that the mother, the pregnant mother or the mother-to-be has optimal, good quality nutrition, she will then have also a healthy baby. So it's extremely important to make sure during that time period that good food is available. It is also extremely important that when children, while being lactated, when they transition to more solid food, that they really get nutritious foods. Often what we see, particularly here in Southeast Asia, is still that these babies, they get some diluted rice porridge, they get some diluted rice water. And this is something that is not optimal. Maybe I should mention also affordability comes particularly here into the game because those, as I said, nutritious foods, they're rather expensive. And that's why we still see this monotonous diet where we have, half a kilo of rice being consumed and nothing else. And during pregnancy and in early childhood, it's extremely important to have quality food. And the quality food is expensive. So affordability is a big key barrier to actually achieving good nutrition in those life stages.
Since affordability is a challenge, what role does food fortification play in making nutrition more accessible?
Actually, it's good that you mentioned this because food fortification is a very well accepted public health strategy, very cost effective. And what we are doing, we're actually bringing back the vitamins and minerals that are lost and the nutrients that are lost during processing the food. And it's a really simple way to bring more nutrients, micronutrients to the table. For example, we have strategies that are being taken up in Southeast Asia. So we fortify fish sauce and soy sauce with iron, which is very important during pregnancy and also during childhood. We have wheat flour fortified with multiple micronutrients. And in Indonesia, particularly, all the cooking vegetable oil is mandated to be fortified with vitamin A. We also try, and specifically to Asia, not only Southeast Asia, but in the wider context of Asia, we try to fortify rice with multiple micronutrients because rice is still the main staple, at least in Southeast Asia. And therefore, it would be really good to have low-cost food, but being fortified so that more nutrients come to the table and to the plate. This is not a big cost. Wheat flour is as expensive as fortified wheat flour. Fortified soy sauce is as expensive as fortified soy sauce, etc.
Oh, that's a great point. We've seen food fortification work in many places.
Yeah.
But what about adolescent nutrition? What's being done to support young people in making healthier choices?
I think adolescence, for me, having myself children, it is extremely important because during adolescence, you set so many behavioral patterns into stone, so many food habits into stone. So what you need to do is you really need to try to reach your adolescence group and teach them healthy lifestyle choices, good food pattern or good diet pattern behavior. And I know that social media plays an enormous role in this, for the good and for the bad, because there's a lot of influence going on. And we really need to use those same means to address our adolescents. Because let's not forget, adolescent girls, in this case, they are our future mothers.
That's true.
And
Absolutely.
they are setting the stone for the next generation.
So on a malnutrition front, what is it really going to take to make real progress? Who needs to step up? Who needs to really work together? How can a difference really be made?
Yeah, I mean, one of the points that is very crucial is we need collaborative action. There is not one entity who can address the triple burden of malnutrition. That's not possible because it spans so much over different sectors and there are so many different aspects. So we need absolutely the public sector, the governments, we need the private sector. We need also the consumer and we need civil society. So we really have to have collaborative approaches. We have to work in partnerships, in meaningful partnerships.
Let's talk about business stakeholders first. What role should the private sector play? And how can they move beyond just CSR initiatives and make nutrition part of their core business model?
It doesn't make really sense to always list what the private sector should do. But I think what the private sector should really engage much more is how can the private sector develop more nutritious, healthy, affordable foods. And I think what we underestimate is the opportunity that the private sector has, because the private sector is very strong in branding, in marketing, and in education. So why not use the same skills to, for example, reach adolescents and to really go in aggressive education campaigns together, of course, with the governments.
Great recommendations. Now, moving on to the government side, what policies or incentives do you think will actually move the needle?
Well, I mean, I personally, through my work, what I've done so many years, is I still am a bit puzzled why the government is not much more aggressively incentivizing the private sector to come forward with the development of more nutritious, healthy, and affordable foods. So I really do think government should really have a plan to be a bit much more aggressive on that side. They might have to think about tax cuts. They might have to think about subsidies, and also the promotion of healthy lifestyle campaigns should be also on the government, focus. And mandating food fortification is a very good way forward, like we see now in Indonesia and in other Southeast Asian countries. That's what the government should do.
Great recommendations. Okay. So, I'm going to kind of, since we are ending soon, I just like to ask you, is that if we had to boil it down to about 2 to 3 key actions, what should the public and the private sector be focusing on right now? What, according to you, are the 2 to 3 key actions that are important for the now?
I mean, I can give it from my perspective because, of course, we are dealing in a very insecure environment right now. We have the climate change. We have all type of political actions going on. But I would say from the government side, I would expect to be really helping and pushing the private sector to come forward, how to develop healthy, nutritious, affordable foods. Mm-hmm. I would also say that governments should really engage in promoting health campaigns and health, choices of healthy lifestyle. They should put some systems in place, not blaming systems, but really systems so that the consumer, that the youth is really waking up and thinks about, I really should eat a bit better. I should not only snack. And I think that's really sort of the government's role. And we have examples in some countries here, but also, I know examples from Europe where we had TV spots already very early to talk about that we children should actually eat fruits much more than not, that we did. So I think there are ways that a government could engage. And I think here in Southeast Asia, that would be really good. Okay. The second point, what I feel is that we are not leveraging enough the skills of the industry. First, the skill of the industry, as I said before, is their marketing skills. They can brand and market all type of foods to everybody, and everybody is happy to consume them. So why do we not do this also for healthy, nutritious food that are still at a profitable level, but still or really affordable also for the low-income consumer? Because I think the industry branding products for the middle class and upper class, that's what they are doing and what is working very, very well. But I still think we should look into if we can use the same skills also for low-income consumers. So that's one. Education, they're very good in educating. And particularly, I think private sector is extremely successful in reaching adolescents. So why not use their skills, making a real, attractive campaign to reach adolescents so that actually they have a good start and that they hammer in their behavior, good lifestyle and good dietary behavior. And the last one, which is a very serious subject, is maybe we really have to rethink totally how we produce affordable, nutritious foods for the low-income consumer. We have to rethink totally the business model because, as you said, and as I said also before, corporate social responsibility does not do it. That's not sustainable. So maybe we have to think about the production of healthy, nutritious foods like a startup. So why not? Why not go through all those steps that a startup has to do? And at the end, we will have healthy, nutritious, affordable foods, yet still profitable, but at a point where our low-income consumer can buy them.
Very valid points. I think definitely the CSR initiatives need to go because the minute the economy is bad, the CSR initiatives are gone,
Yes. Yes.
So yes, a whole new business model is definitely needed. And with so much focus on startups now, I guess if you have the right person at the right time, with the right amount of funding, maybe we can get that going.
Yes,
so great suggestion there.
That's actually what you just said. Is in my career, what I've seen over the years was, if you have one champion, you can actually move the needle. I mean, you need a champion, be it in government, be it in the private sector, or a consumer, or in a non-governmental organization. But if you have one champion who is really convinced, committed, I saw that you can actually move the needle. There was a very good example. We had a governor in some country in a specific region, and he was so convinced that he wanted to have fortified rice. And he really made that, at least in his region, we had fortified rice with multiple micronutrients. So a champion can really help and can also rally other stakeholders around to go forward.
Dr. Moench-Pfanner, this has been an insightful conversation. Thank you for sharing your expertise.
Thank you for having me. Thank you.
Malnutrition is a shared challenge that demands collective action. Both public and private sectors have a key role to play, from smart policies and food fortification to leveraging marketing and business models that make nutrition accessible and sustainable. More importantly, change starts with one champion, whether it's a policymaker, a business leader, or a social entrepreneur. It takes leadership and collaboration to drive meaningful impact. A huge thank you to our listeners for tuning in. If you enjoyed this episode of CMXP2 InterSect, be sure to subscribe, share, and follow us on LinkedIn and X for updates on future episodes. Till next time, I'm Yashna Harjani, signing off.